And yeah, let me say welcome. Welcome to the World Water Week at home. This time it's a very special edition of the World Water Week. Greetings from Stockholm, not from the office, not from the arena, but from my home. I am Alejandro Jiménez, the Director for Water and Sanitation for SIWI. And I'm very happy to welcome you to this event that is Sanitation and Water for All Partner Exchange webinar. So it has been, we are hosting it from SIWI, but it has been crafted and designed through the Sanitation and Water for All Research and Learning constituency. And I would like to thank all the colleagues from the different organizations that helped us all along the way to make this possible. We have today a very interesting discussion ahead with a very important panel. And as you know, we would be talking about COVID and what has that mean in terms of coordination. This has taken us all as a surprise. This was not planned in the original Water Week, as you know, but through the collaboration with the SWA, we thought it was really important to take this topic forward for discussion in the Water Week. And while you all come in, and I think I have consumed already a couple of minutes to let more people come in, I would just like to start and give the first word to my dear colleague, Isabel Alvarez, who will give us a short presentation about what have we learned about coordination on the COVID in an exercise that SIWI has been done together with UNICEF. So over to you, Isabel. Thank you.
Thank you, Alejandro, and hello, everyone. The health emergency caused by the coronavirus created unprecedented circumstances for the WASH sector. In light of this, we at SIWI conducted a study with the support of UNICEF to map the different WASH COVID responses. Today, I have the pleasure to present the findings from this study. We wanted to identify the response actions of the WASH sector stakeholders, such as governments, decision makers, regulators, utilities, among others. The mapping exercise was carried out to identify these key measures from the period of April to June, which included a total of 84 countries. The research was 100% web-based, and it was complemented by interviews from key stakeholders. The framework used to analyze these measures was based on two different levels, national and subnational. The measures then were classified into 5 pillars. The first, to intensify awareness raising campaigns for hand washing. 2, strengthen infection prevention and control at households and institutions. 3, preserve the ability of all people, especially the most vulnerable, to meet their basic wash needs. 4, guarantee continuity, affordability, and safety of water and sanitation services. And 5, providing technical and financial support to utilities. From a total of 15 measures mapped, 2 of them involve coordination. As you can see in the first graph to the left side, shows the coordination between governments and service providers in terms of technical and financial assistance. We found no measures for 74% of the countries. 17% showed national measures and 10% subnational measures. The second graph on the right-hand side shows the different coordination mechanisms within the WASH sector and among other sectors. We have found that 60% of the countries have shown national measures and 6% subnational measures. In the rest of the countries, we haven't identified any measures. there has been more and more regional and sub-regional coordinations platform activated as the emergency went by, with WASH stakeholders sharing experiences to assist in strengthening country responses. We have seen some good examples of coordination among different sectors in the implementation of mass media campaigns to create awareness or to combat disinformation. Also, a national coordination platform is the Caribbean Disaster Emergency Management Agency, which is a regional intergovernmental agency for disaster management. This mechanism created response teams to reinforce the preparedness and social protection systems. This has been key to ensure access to safe water, emergency sanitation measures, and efficient coordination of humanitarian assistance. As we have seen, this is a general overview of our findings. The published notes with more details can be found in our website. Now, to see how well these mechanisms have worked in practice and to understand the different challenges, our colleagues will provide 3 concrete examples. I will now give the floor to Alejandro, who will introduce us to our panelists. Thank you.
Thank you very much, Isabel, for that initial overview. And then let me just make the short announcement of the translation. My colleague Ricard has included the instructions there, so you have to click on the interpretation icon and then select the language. Para los compañeros que quieran traducción al español, hay un icono que es como un globo de interpretación y ahí pueden elegir el idioma que quieran. Sorry for that, and then use the interpretation if you really need it. Otherwise, I will just want to introduce our panel, and I would start to give first the word to Mr. Itsuro Takahashi, who will tell us about how the WASH cluster coordination mechanism has been working in Ethiopia. Later, I will give the word to Mr. Koenraad Vancraeynest from Ecuador, who will tell us about an example of coordination between water and education. And finally, I will give the word to Dr. Apurva Chaturvedi and Dr. Pratibha Singh from India, who will tell us an example of coordination in the health sector. So without further ado, I will give the word to Mr. Itsuro. The floor is yours. Thank you.
Thank you, Alejandro. First of all, many thanks for having me.
Sorry, there is a technical problem with Itsuro. I think we have lost him for a second. So perhaps while we try to solve this issue, I'll then give the word to Koenraad from Ecuador. Please, Koenraad, can you tell us then instead about the experience of Ecuador and education? Thank you.
Yes. Good afternoon for colleagues in Stockholm and elsewhere in the world. Good morning from Quito, Ecuador. Maybe we can go to the Ecuador slide. Yes, thank you very much. So my intervention will focus, my name is Koenraad Vancraeynest. I'm coordinating the WASH cluster in Ecuador, and my intervention will focus on how the WASH and education sector in Ecuador were coordinating before the COVID-19 pandemic, and how this coordination has been boosted due to the COVID-19 emergency. and specifically the big challenge to get children back into the schools. So before the pandemic, around mid-2019, the National Institute for Statistics engaged with the Ministry of Education to establish an SDG baseline on WASH in schools. So the information source used was the Education Ministry Information System, which enabled to establish a baseline and also tendencies from the last 3 years, although also critical data gaps were identified in this exercise. So subsequently, WASH in schools was also included in a WASH bad sector review exercise from the water and sanitation sector, which was coordinated by the Ministry of Water and focusing principally on rural areas. So this was in November 2019, still before the pandemic, as you know. So the first COVID-19 case was detected in Ecuador on February 29th, and the National Emergency Committee was established, and the decision to close all schools was taken by the Ministry of Education. And more or less simultaneously, the WASH cluster and education cluster coordination mechanisms were activated by the cooperation, and this was upon request from the national government. Both of these clusters were coordinated by UNICEF. Subsequently, as the Ministry of Education realized that access to WASH would be critical to have children going back to school during or after the pandemic, the ambitious decision was taken to do a rapid WASH in schools assessment, including all public schools in Ecuador. The assessment was based on the core questions and indicators for measuring WASH in schools and the framework of the SDGs from the Joint Monitoring Program. As such, almost all of the more than 60,000 public schools reported the requested information in 6 days, only 6 days, using the COVO platform. And this initiative was supported by the WASH and education clusters. You can see the service levels as published in the latest GMP progress update on WASH in schools for water, sanitation and hygiene in Ecuador in the figure on the slide, where it's very small, but it's representing the 3 subsectors, and every point with colors indicates a school, a public school in the country. So currently, the WASH and education cluster are supporting the Ministry of Education in a costing exercise to cover the gap in access to basic WASH services in schools. So from this, this intersector coordination, lessons learned and challenges are many. And specifically in the context of COVID-19, but just to share the following 3 with you. First of all, WASH in school services are crucial for the back to school campaign, and information is critical. But really the question is if and how the gap will be covered. Obviously, the gaps identified are important, and the investment necessary for that is also very important. Then second, a very common question raised during the exercise: who is responsible for WASH in school services? Where does the responsibility of the service provider ends, and where is the education sector itself responsible? How does this discussion can be resolved to contribute to close the gap in access to WASH in school services? So we noted really that this discussion has been raised very strongly, which is a very good opportunity. And third, the COVID-19 pandemic created really an unprecedented momentum in Ecuador to strengthen the work on WASH in schools, including policy documents, guidelines, capacity building, and investment. So as the pandemic hopefully fades out in the future, it is important to sustain this intersectoral coordination over time towards the end line of the SDGs in 2030. So this is what I wanted to share with you from the Ecuador case. Thank you very much.
Thank you very much, Koenraad. And indeed, you touch upon very important point, right? So this story shows an important effort of coordination and impressive effort in terms of mapping the level of access in very few days, something that we have been perhaps, or the people working in the country struggling for a number of years, and then it can be done in a few days. But then how will we address the gap, right? And how can we keep this momentum moving forward? So we'll come back to that, and I also encourage the participants to put your questions in the chat box, and then after the 3 presentations, we will then come back to discuss those with the panelists. And without further ado, I would give the word to Dr. Apurva to tell us about the experience in India while we recover Itsuro, hopefully from Ethiopia later on. Dr. Apurva, over to you.
Good evening, everyone, and namaste from India. I'm Apurva, and I'm the health specialist in UNICEF India Country Office. And as I speak today, India is in unlock phase 3, with our infections crossing 3 million mark, 57,000 plus deaths, and we rank 3rd in the world, just behind USA and Brazil. And while we had our first million cases in a span of 116 days, this 3rd million has come up just in 16 days. So you can imagine the way this infection is spreading across the country. And UNICEF India Health and WASH team and overall the India Country Office adopted a multi-sectoral approach to its response strategy, coordinating with the relevant ministries and partners. And the health and WASH sectors, we supported the Ministry of Health and Family Welfare and other line ministries involved in the pan-government India response, following one health approach with 2 goals. One was to support the reduction of transmission, and second, most important, to mitigate the impact of pandemic on vulnerable populations, especially the children and young people and the care providers. And WASH and health have been the trusted partners of Government of India, not only during pandemic, but we have a track record which is proven for supporting the government interventions, both by the health and WASH teams together. And during the COVID times, the teams came together with the WHO and other UN agencies, and we activated our entire machinery to support the government with our teams across 13 field offices, where we support 24 states through these and over 100 districts which were prioritized. And our action and response was aligned to the UNICEF COVID-19 Humanitarian Action for Children Appeal for 2020 and WHO Global Strategy response. So while we responded across various pillars, right from being part of the technical committees at the national, state, and even in the districts where we are present as both WASH team together, providing our inputs into the drafting of guidelines, protocols, procedures, we were heavily engaged in the capacity building of service providers. And there are certain numbers which I would like to quote that would give us an idea of how we were extensively involved. So UNICEF specially supported the health facility preparedness for across 500 COVID centers, which were level 1 COVID centers identified by Government of India. And this was done together with WHO, and within a short span of 3 days, this exercise was completed across 24 states. And this exercise helped the Government of India in understanding what are the gaps, what are the bottlenecks which need to be filled, including the WASH measures and the IPC measures and the supplies, equipment, human resource. So it was a comprehensive assessment which led to the strategic planning and actions across. And we've been able to support, as a result of our coordinated action, 2.3 million beneficiaries received critical WASH supplies. We have 1.3 million healthcare providers who were trained on COVID management, which included important aspects of IPC and WASH. There were 650 million people who received UNICEF messages on COVID response, including hand hygiene, respiratory etiquettes, and beyond. And this included 45 million people who were directly engaged through risk communication and community engagement. So these are some of the actions. And while we also support our actions in the UNICEF supported districts across facilities, engaging at facility community platforms together. And there were certain challenges which I would like to highlight, and then I hand over to Dr. Pratibha, who will provide some examples of how we overcome these challenges. One of the most important challenge was that India is a country with marked inequalities. And during this COVID times, we saw a huge migration of people moving from urban cities to going back to their rural areas. And then there were these seasonal employees who were staying in urban slums. So here already the access to safe water for hand washing or for the sanitation was a big challenge. And this migration and this movement created and worsened the further situations. Also, we saw that the gender inequality was further increased during the COVID times, and women are bearing more brunt of it, and especially the older women who are not having access to income or access to services compared to the other people, and also the persons with disabilities. So for them, access to wash measures become more difficult. And then another big challenge is the psychosocial issues and mental health issues which are coming up. The health workers, the sanitation workers, this has been a long pandemic and it's going to stay for a while. And now our health workers and providers and sanitation workers are getting tired. They are getting overworked. They are getting stressed out. So it is now the time for us to take care of them. And these are some of the broad challenges. And I hand over to Pratibha to please speak and add further on our challenges and what measures did we take and some good examples from the state to further add to it. Over to you, Pratibha.
Thank you, Dr. Apurva, and good evening to all the panelists and attendees from India. Also, like adding to what Dr. Apurva has just mentioned about challenges, there are some issues which are like persisting and which also magnified during the COVID-19 pandemic situation, because the healthcare facilities in India, and also given such inequities, disparities across the country, we were focusing more on saving lives. So the somewhere down the priority line, the emphasis on water, sanitation, hygiene facilities, and also the wash behaviors was somewhere less prioritized. So because of that, the healthcare system was not really geared up in terms of wash to meet the requirements. So we have like learned the hard way during the pandemic also, and our efforts to strengthen the wash infrastructure will definitely continue. And one of the key challenges remains the hand washing behavior in the healthcare facility. So that's one major issue we will have to look into in future. And then again, our exit strategy and sustainability plan, that's a challenge, because UNICEF, like in full coordination between health and our wash teams, we give hand-holding support and supportive supervision for the entire wash in healthcare facility programming. But somewhere down the line, the ownership of the government and the exit strategy, that is somewhere we have to focus upon. Because UNICEF in India, we focus on the aspirational district, the so-called aspirational districts, because these districts have some of the lowest indicators in terms of water, sanitation, hygiene, education, also in terms of the healthcare facilities, and maternal and childhood mortality, and general health and well-being of children. So these districts we continue to focus on, and somewhere that kind of sustainable strategy has to be there. And also one major issue remains to be addressed is about the wash indicators have to be included in the routine monitoring management information system, the monitoring mechanism of the entire health program in the country. So somewhere that has to be strengthened. Now I'd like to speak briefly about some of the best practices we have experienced in India, and I am sure they can prove to be of learning also, because in India we are a country, we have about say 9 languages, and we have about say 50 different dialects across the country. So it's a very diverse scenario. And also in terms of economic and socio-economic parameters, the country is very diverse. So some of the key learnings that we had in this experience was that on one hand, while we were addressing the issue of how healthcare facilities can gear up and be prepared to meet the influx of so many patients for due to corona pandemic. We were also focusing on the community aspect. So we were strengthening the community like modality of dealing with the COVID pandemic through the frontline workers from across different departments. So from education, from health, from WASH, all these frontline workers were working more on creating awareness in the communities to prevent transmission at all level, and still that thing is continuing. Then, as Apurva was mentioning about inequities in India and also the problem of migrant laborers and the floating population in cities, and also the people who were stranded because of livelihood issues, they are like lots of sections of our populations are migrant. They don't stay in their native places. So these are people who reside in slums and the temporary settlements, and the settlements which are not very permanent are not well equipped in terms of water, sanitation, hygiene. So there was a specific strategy which was devised with government on that front. So these migrant laborers and people who are left stranded, they were provided with access to proper nutrition and shelter, and also their wash requirements were taken care of. And still UNICEF is closely supporting many government authorities through provision of the dignity kits. We are also leveraging resources so as to meet all these kind of requirements. Then one major thing we have been able to, we saw the value of convergent effort, and the engineering department in the country, the water, sanitation, hygiene, they were like geared up like never before in supporting the healthcare facility staff in terms of making sure there is a 24/7 water availability across the health centers. And I'm happy to inform that the national flagship program for water that has made special provision for healthcare facilities to give them 24/7 water supplies. This is very important in the context of India because we also suffer from seasonal water shortages, and we have just we are just through the the very water scarce summer season. So that kind of issue has also been a best case example. Then in some states we have
Dr.
this
Pratibha,
challenge of biomedical. Yes, Alejandro. Yes, please.
Please close as soon as you can, please.
I will take 1 minute more. Just last thing.
Yes.
So we are also supporting the government nationally and also the state level on the management of biomedical waste. That is another convergent area where we have been able to bring the two departments, the health department and the engineering on the pollution control department together. And dedicated trainings have started on that front. And also we are looking at the mammoth problem because this is an unforeseen pandemic. So the biomedical waste magnitude is unimaginable, and system is overwhelmed at all levels. So that's why we are slowly moving towards system strengthening in that regard. So lots of experiences are there, and I would welcome, because we don't have much time right now, so I would welcome all panelists and other attendees, so they are most welcome to reach out to us for further experiences. We'll be glad to share that. Thank you so much for patiently hearing me. Goodbye, everyone.
Thank you very much, Dr. Pratibha and Dr. Apurva, for telling us about the issues of the coordination with health and those experiences that have been happening through UNICEF in the last months, and quite impressive also set of coordinated actions, as well as also bringing some policy changes already in terms of the 24/7 for the health centers, and also trying to engage in enabling environment and bio waste collection and so on. So thank you very much, and not to forget the health and sanitation workers that are now really at the top of stress, and this is far too much, perhaps in far too long pandemic crisis for them. So yeah, without further ado, and as you know, this year we have very short sessions, I would like to give word to Mr. Itsuro, who I think came back a few minutes ago, and I hope he's still there to talk with us about the cluster coordination in Ethiopia. Mr. Itsuro, the floor is yours. Thank you.
Thank you, Alejandro. So sorry, I had some technical problem, but again, I'm happy to be back here. Thank you very much for having me here as a panel. And I'm very happy to share our experiences as a WASH cluster in Ethiopia in response to COVID-19 pandemic. And since we don't have much time, I just want to briefly explain the mechanism in Ethiopia. As you can see in this organogram, this is a coordination platform for COVID-19 in Ethiopia. This platform is called as Emergency Coordination Center, ECC, which was activated as right after the first confirmed COVID case in Ethiopia in mid-March. And this platform is led by the government. So all stakeholders working within the government framework in Ethiopia, whether it's a development or emergency response. And this coordination platform is covering all multi-sectoral coordination except health. This health response is coordinated by another dedicated platform called Emergency Operations Center, EOC. So this mechanism and structure itself a bit complicated. But you can see WASH in this part of diagram, which I put red square. WASH cluster is working with this WASH branch director in order to fill the gap to respond to COVID-19. And this is how we are working. But very peculiar arrangement under COVID-19 is coordination between emergency and development, which usually doesn't happen well, even though we have emergency development nexus as a key agenda for humanitarian response. And you can see the small box in your left, which I put manually. You can see the name of Ministry of Water, Irrigation and Energy, in which there are both development and WASH cluster. This is a platform, ad hoc platform, which was developed by the minister, state minister, to respond to the COVID-19 jointly between development stakeholders and the emergency stakeholder. This is quite interesting initiative taken by the ministry because we used to work in silo, but because of COVID, we started working together. This is one of our great invention of Nexus approach in Ethiopia. When it comes to intersectoral coordination, as I mentioned, this ECC is working as a multi-sectoral coordination platform, but as a humanitarian coordination platform, we have another platform which is called as EICCG, Intercluster Coordination Group, led by OCHA for humanitarian response. So we used to work with different clusters, different sectors in practice. And so in response to COVID-19 pandemic, WASH cluster regularly closely work with this health cluster and also shelter cluster specifically. In terms of coordination with health cluster, we have many healthcare facilities which don't have reliable WASH services. As everybody knows, this IPC and hand hygiene and social distancing is quite important. But in many healthcare facilities in Ethiopia, there is no reliable water supply, and latrine is not working, and there is no hand washing stations. So we closely work with the health cluster to identify the gaps in different healthcare facility, and WASH cluster pushed different partners to work on that. And on the other hand, in Ethiopia, we have about 1.7 million internally displaced population, which we call IDP in the country, 1.7 million. And those IDPs are key concern because they are living in a congested camp-like setting where there is no adequate water for hand hygiene. And therefore, the WASH cluster started closely coordinating with the shelter cluster to list up priority IDP camps for urgent response. As a result, we prioritized 57 IDP sites for the joint intervention, but out of 57, we picked up 20 IDP sites as our priority areas for our intervention. And that's how we worked with the shelter cluster and beyond this inter-cluster coordination group mechanism. So to answer to the title of this session, the coordinated response under COVID-19 is feasible and worth the effort. So based on our experience in Ethiopia, I would say yes, definitely. Without coordination, the response to COVID-19 won't be effective, especially in the least developed countries like Ethiopia, where level of several basic services are quite low and number of vulnerable people is quite large. So it's quite feasible, but there are so many challenges too. One of the key challenges I had observed was this work from home environment, virtual meetings arrangements. As some of you know, that the internet connectivity in Ethiopia is quite bad. So whenever we organize coordination meeting on Zoom or WebEx or Teams, all of a sudden power cuts and we couldn't continue discussion, we couldn't share information. And even if we ask partners and the information management officers to send us the updates, the coverage, gaps, needs, we couldn't get timely information. So this work from home and virtual meeting arrangement in Ethiopia is really challenging to continue the effective coordination for COVID-19 response. And so I really realized the value of face-to-face communication as a tool of coordination, such as having a quick chat before and after the meetings, over the coffee, at the corridors. Those are significantly important to strengthen coordination, but we have to stay at home and sometimes office is completely closed. So this is one of the biggest challenge I observed. And on the other hand, the great opportunity I had observed during this coordination and the COVID-19 was nexus approach between emergency and development, which enables both development program and emergency responses come together to try to meet very large response needs in the country. And so we need to make more effort to make Nexus really operational. We still have so many challenges, but this is a great opportunity for development stakeholders and emergency humanitarian stakeholders to come together to respond to the COVID-19 with our needs. So those are the some of the observation I had. I have so many more, but since we have limited time, I stop here and thank you very much. And that's all from my side. Over to you.
Thank you, Itsuro. Thank you very much. And you really also show the challenge, right, with the internet connectivity, and that's really important in many countries. And when you want to coordinate across different geographical level, coming back to the perhaps community, coming down to community and small municipalities level, which also have poor connections in general. So yeah, thank you very much. And this was also to show the complexity of coordination mechanisms, right? Because we always think, oh, we need to coordinate better, we need to coordinate across sectors. Yeah, but yeah, how does it look like in reality, right? And that is exactly what perhaps your slide shows as a challenge. But as we are short of time, I would like to come back to some of the panelists with some questions. There have been a few questions in the chats. I would try to summarize a couple of them. Perhaps the speakers can try to type or get in touch through email with the people. But I will give the word to Koenraad and then to Dr. Apurva again and to Itsuro. What is, I mean, you all have shown some potential, like yeah, the coordination with the education sector, in health, also some good examples, this development nexus and humanitarian coordination opportunity with COVID. But what will it take to realize this opportunity, to make education and health and development and humanitarian really talk to each other beyond the immediate emergency. You have like a minute or so, each of you, to say something about this. Thank you. Koenraad, please, you go first.
Yes, thank you very much. So I think your question is also related to various questions that were on the chat, but I think it will just be very important to not going back to business as usual as before the pandemic. So see this emergency as an opportunity, and also I think a lot of people will be aware that this could happen again in the future. So the importance to maintain this coordination between sectors, in the case of Ecuador between the WASH and education sector, should be conscious of this and see these mechanisms, which we currently, obviously this coordination is happening currently within the structure of the emergency response. And as one of the participants mentioned, what are the institutional arrangements for the future to assure that this coordination is maintained in the future. And it will be very important effectively to have these arrangements beyond the emergency response coordination mechanism actually. And this is something we will definitely be working on as UNICEF and as clusters also, to see how this can be put in place best. Over to you.
Thank you very much. Dr. Apurva or Dr. Pratibha, one of you want to take on this question for a minute or so? What will it take to realize the opportunity of COVID in terms of increased coordination?
I can come in. Yeah.
Please.
So Alejandro, I would just like to emphasize that COVID is not the only thing which has given this opportunity. Rather, in India, health and WASH sector, we started coordinating. If I exactly specify the year, it was 2013 when we came together as UNICEF team for the equity focused approach. That's when the government started focusing on moving from numbers to quality of care. And when you talk about quality, equity and dignity, how can a service be dignified if a woman doesn't have a clean toilet in the hospital facility, or there is no biomedical waste management? So we were already on this journey of coordination with certain flagship programs like Kaya Kalp and various big programs in India where the teams were supporting. But yes, with the COVID, this coordination was further streamlined and more institutionalized, and there were new challenges where we had tested our capacities. And going forward, while we know that we are sprinting, but this is a long marathon to sustain. So we will be coordinating our response in a manner where we support the health system strengthening measures and contribute to a resilient health system, because this is just one virus. We don't know what the future holds in its kitty. So that's how we are responding. Over.
Thank you very much. And thanks for making the point about resilience and making ourselves ready for the future crisis, whatever it would be. Itsuro, any remark? What will it take to make use of this opportunity?
Well, I think, yeah, the major points have been already addressed by the other panels, but I think the both sides, development stakeholders, including donors and other bilateral agencies, also need to change their kind of mindset, because at the onset of COVID-19 response, there are many institutions which requires better wash services, hand washing stations and 24/7 water supply, even better latrines. When it comes to the quarantine centers, treatment centers, isolation centers, the point of entries at the borders, there are so many institutional facilities to be improved, which humanitarian partners cannot address with the limited funding for the short-term response. And I think we need to change our kind of idea or even mentality in terms of the resilient wash facilities in many countries as far as Ethiopia is concerned.
Thank you very much. Thank you very much. And I think one additional challenge that had been raised by some of you have been related to the hand hygiene, right? And the absence of both facilities, infrastructure, as well as perhaps the adequate behavior change. So I don't know if Joanna Steve Mills from the London School of High and Tropical Medicine is there. I wanted to give her a minute to give a statement that for all of us to remember this important initiative and how this should also be guiding all efforts across sectors, because as you know, hand hygiene is critical to the COVID response. Joanna, are you there?
Yes, I'm here. Thank you, Alejandro. Thank you so much for that introduction, and especially for the opportunity to just have 1 or 2 minutes on this call to speak to you all. I've listened with great interest to the examples from the 3 countries, and especially about the research that SIWI and UNICEF carried out around coordination. And really, I just wanted to take this opportunity to raise awareness about the Hand Hygiene for All initiative that is co-led by WHO and UNICEF, for those of you who aren't yet aware of it. And when I finish this intervention, I'll just put the link in the chat. But essentially, this was launched on the 26th of June as a direct response to COVID-19, but also as a direct response to all of the challenges that have been aired on this interesting discussion today around how you take the improvements and sustain them into development and beyond humanitarian response. So the Hand Hygiene for All initiative, it's a global call to action, essentially. And it aims to bring together international partners, national governments, public and private sectors, and civil society across multiple settings. Just as the previous speaker, Mr. Itsuro, had said, intervention is needed across multiple settings. And we want to ensure that there is affordable products and services available, and with particular focus on disadvantaged areas. So really, it's about trying to support development of, if you asked me, how could we try to ensure improvements are sustained? One of the things that this initiative is really trying to encourage is that the development of country roadmaps that try to bridge together the national COVID-19 preparedness and response plans with mid and long-term national development plans to really ensure that hand hygiene is a mainstay in government programs within and beyond this pandemic. And why we're kind of organizing at the global level, it was very interesting to listen to coordination efforts in the national and subnational level. Well, how can we coordinate at the global level with donor responses, with private sector? We have core partners from the World Bank, from the World Economic Forum, the International Federation of the Red Cross, the London School of Hygiene and Tropical Medicine, the International Labour Organization. I could go on, but the idea is to try and create that framework for response at the global level that really supports the development of these country roadmaps and country level response, which all of you are doing so wonderfully well. So the only thing to say is I'll be in touch with all 3 panelists to try and follow up and maybe produce some case studies that could be shared more widely with a view to really garnering your expertise. So thank you very much for the opportunity, Alejandro, and over to you.
Thank you very much, Joanna. Thank you for that reminder about the hand hygiene approach, and please put the information in the chat. And without further ado, I would like to give the word to Ms. Sareen Malik, who is the Executive Secretary for ANEW and also part of the Sanitation Water for All board, and to give us some concluding remarks on what this session has suggested you. And yeah, please, over to you. Thank you.
Thank you very much, Alejandro. Thank you very much to our panelists, Itsuro, Koenraad, Dr. Apurva, and Dr. Singh, for really showing us today not only the merits of coordination, but also the power behind coordination. It is unfortunate we had to wait for the pandemic to really And I like what Itsuro mentioned, to really, wake up some of these clusters and some of the coordination mechanisms that were taking place. But also coming back to what you mentioned, Dr. Singh, that this has already been taking place in India for a while. Just very quickly, I think an acknowledgement, and I know with Alejandro we looked into this, that not to acknowledge also the role of local civil society organizations and networks who have been in COVID WASH responses, and key as well to coordination. After all, who else is able to reach deep recesses of society? But at the global level, thank you very much for showing that, yes, multi-stakeholder platform, partnerships, collaborations have actually given a boost to coordination. And we hope that, one of the key takeaways is that coordination is just not a footnote that jumps to life every time there's an emergency, but rather is mainstream within the programs and adequately resourced and adequately represented. On that note, we invite you all really to be part of the SWA partnership and for our efforts to ensure that coordination really is part of everyday operations. Thank you very much.
Thank you very much, Sareen, for your wise words, and also for all of us to remember that the role of civil society in coordination, and that the multi-stakeholder coordination is critical to success. And that is exactly what SWA is about. And here in this slide, you can see how to follow the recording, how to follow some of the resources that have been shown, and also don't miss the next Sanitation Water for All webinar in a couple of weeks. That would be about community water management to celebrate the Latin American Day of Community Water Management. You have it there. Stay tuned. Please join us in that webinar. And with that, I would just like to thank all of you for being here today, and also for especially the presenters, the panelists that have made a great effort in different time zones to be here with us and to make a lot of contributions in very few minutes. Thank you to the participants as well for animating the chat, and I hope that you will have more time to exchange when this meeting is over. So thank you very much to all of you, and hope to see you again in another sessions at the World Water Week at home. Stay safe. Take care. Bye.